Adolescence is a critical time in a person's life. Recognizing the need to provide adolescents with enhanced well-being services, the Government of India started the Rashtriya Kishore Swasthya Karyakram or RKSK in 2014 under its National Health Mission program. RKSK is an expanded version of a previous scheme that seeks to provide sexual and reproductive health services. It aims to also address issues faced by teenagers. Nutrition, violence, substance misuse, mental health, and non-communicable diseases are some examples. The implementation of the scheme rests on the shoulders of counselors running clinic-based services as well as health and outreach workers. However, when we studied its structure and fund flow process in a district in Uttar Pradesh, we found that this valuable resource often has little incentive and limited facilities to do their jobs better. For example, ASHA, who are trained female community health volunteers, receive only Rs 200 for each adolescent health day they are supposed to organize. These days are conducted in Anganwadi centers or other public spaces at the village level once in 6 months and play a vital part in the program's success. Now consider the ASHA's difficult task. They need to convince often unwilling parents and families to allow and accompany adolescents to participate in the Adolescent Health Day and make sure the adolescents attend. For this, ASHAs are supposed to share information about sensitive topics such as safe sexual practices, menstruation, and gender-based violence, topics that are still not discussed openly in families, let alone with teenagers. ASHAs are required to identify and recruit 2 adolescent boys and 2 adolescent girls as peer educators to carry out awareness-raising tasks among school-going and non-school-going adolescents. For every peer educator or Sathya brought into the program, the ASHA receives only Rs 100 as her incentive. As per the national guidelines, the estimated budget for ASHA incentives at the district level is supposed to be around Rs 17 lakhs. When we followed fund flows in the district, less than Rs 2 lakh was spent in 2018 to 19 and around half of it was spent in the first half of the next fiscal year, that is 2019 to 20. Meanwhile, peer educators do not get any regular incentive under the scheme except a token amount during the initial training. Many peer educator girls face difficult challenges such as traveling from their homes to district level or block level community health centers or fulfilling the expectation of regularly reaching out to the non-school going adolescent girls staying in faraway corners of habitations with a rural population of about 1,000. Lack of support in facing these challenges causes them to even drop out of the peer educator's role. Strongly motivated peer educators can play an important role, often alerting authorities of instances related to child marriage, domestic violence, gender-based violence, or substance abuse and other social ills. We found that allocations in 2019 to 20 meant for trainings which could have helped them dropped to 1/7 of the previous year. Also, among our findings was that during the last 4 years, no allocations or expenditures were made on procuring sanitary napkins. Earlier, stocks of sanitary pads were reported to have remained undistributed as the funds for transporting them to the last mile were not earmarked. There is a positive in the fund story though. Funds are now released in a pooled manner without assigning a particular amount to a specific budget head. This is done to give maximum flexibility to spend based on local needs in a given month. So, how is the RKSK budget allocated and spent? To understand this in detail and the impact this has had on the people implementing the program, download our report on the scheme from our website.